Good afternoon. I want to run through a few updates on the Commonwealth's COVID-19 plans. Over the weekend, I think many of you know, we launched new efforts to secure more personal protective equipment for our first responders and medical workers. We initiated a significant piece of our surge capacity plan to help hospitals free up more space. We launched another project in cooperation with the Mass Medical Society to recruit medical professionals to support our medical providers. And I'll also share some information regarding unemployment assistance the unemployment assistance process as it relates to the CARES Act, which I think everybody knows the President signed a couple of days ago. Over the weekend, the Commonwealth conducted close to 10,000 new tests for COVID-19 on our residents, which brings our total number of tests to almost 40,000 conducted at 21 labs statewide. And on both Saturday and Sunday, we continued to exceed our goal of 3,500 tests a day. We'll continue to expand testing capacity as time goes on, and as we've said before, ramped up testing combined with tracing and tracking and isolation and quarantine is going to be a key to how we move forward in the long run on managing this virus. While these have been unprecedented and difficult times, the people of the Commonwealth continue to respond with tremendous strength and generosity. We're fortunate to be home to many resourceful people and successful businesses that have met this pandemic as an opportunity to do something positive and good for their communities. Our command center has been contacted by hundreds of individuals and businesses willing to donate or sell personal protective equipment or PPE to the Commonwealth. Over the weekend, we also received a shipment of PPE from the Strategic National Stockpile. Deliveries began on Saturday and have continued through Sunday, and the warehouse has been inventorying items throughout the weekend. We also heard over the weekend that the Assistant Secretary for Preparedness and Response at Health and Human Services at the federal level approved our request for at least 1,000 ventilators, and we should be receiving those soon. So far, we've made hundreds of deliveries to frontline healthcare providers and first responders, and last week, more than 28,000 masks and 120,000 pairs of gloves were distributed, and we currently have approximately $50 million on order for additional supplies. But obviously, we will need more. Yesterday, the Command Center launched an online portal where individuals and companies can donate or contract with the Commonwealth to supply PPE. The portal is simple and a very streamlined and easy way for our Command Center to process, collect, and distribute donations more effectively. By visiting the COVID-19 PPE procurement and donation website, businesses and organizations can sell or donate critically needed personal protective equipment, and this would include N95 masks, surgical masks, respirators, goggles, gloves, protective gowns, and hand sanitizer. And the new program isn't just about donating or selling. We've also heard from many people and businesses who may not have gear to send us, but do have facilities that properly converted can be used to generate gear all the time. And our administration's created a process where local manufacturers can get more information on how their businesses can start to produce the equipment we will all need. This function is a result of our Manufacturing Emergency Response Team, which is co-chaired by Housing and Economic Development Secretary Mike Keneally and Mike Tomasi, who's the President and CEO of AccuRones. We've already seen Massachusetts companies do this, and it's both impressive and inspiring. For example, New Balance will begin manufacturing face masks for those battling coronavirus. They're producing prototypes in their Lawrence manufacturing facility and hope to scale production using their other New England factories soon. By harnessing the capabilities of Massachusetts skilled manufacturers, we'll be able to get gear into the hands of our frontline workers faster. We still have much work to do to secure more supplies from both the national stockpile and from other supply chains, but we've always been impressed with the ingenuity of our residents and businesses, and this outbreak, undoubtedly stressful for all, has shown once again that people can step up in creative and imaginative ways. And companies like New Balance and so many others that are taking this in stride and coming up with solutions is exactly what we would expect to see happen here in the Commonwealth. It's the truest example of the spirit that makes Massachusetts so special and what we're so proud of. And I want to thank everyone who's reached out so far to support our first responders, emergency management personnel, and healthcare workers as we continue this fight. Protecting the people who work every day to keep us safe and healthy is obviously of huge and significant import to all of us. And that's why we're pursuing every possible angle we can find to get them the gear that they need. This weekend, we also launched another initiative to recruit medical professionals to support our hospitals as we ramp up our medical capacity. We partnered with the Mass Medical Society to match health and medical volunteers with our communities and healthcare providers based on skill sets and requirements. There's an immediate need for respiratory therapists and public health nurses. And since launching this initiative, more than 1,800 people have already registered, and we're incredibly fortunate to have so many highly skilled technical professionals in our medical community here in Massachusetts. Other medical professionals who might want to help can sign up by visiting mass.gov/COVID-19. To all the doctors, nurses, and folks who keep our hospital running, your compassion, your bravery, and your commitment to your fellow Commonwealth residents is unbelievable and outstanding, and we are all enormously grateful. I do want to talk a little bit about a couple of other initiatives around planning for the surge. One of the core functions of the COVID-19 Response Command Center is to expand our existing capacity to serve people once the surge arrives. And they are working on a variety of initiatives to ramp this up. First of all, reducing pressure on the system overall, in part by issuing more than 30 orders or guidance aimed at keeping folks who don't absolutely have to be in the hospital out of the hospital, making it possible for clinicians to engage with one another in more flexible and management-specific ways, and also in developing additional capacity so that the Commonwealth has the ability to work with our colleagues in the healthcare community to ensure that we have the right kinds of beds in the right places to serve people once the surge arrives. This week, the COVID-19 Response Command Center is establishing a dedicated skilled nursing facility, a set of dedicated skilled nursing facilities to care for older adults who are infected with COVID-19. This is one more way to relieve pressure on hospitals and maintain acute care capacity for patients who are critically ill. This will allow hospitals to move more patients into the recovery phase and out of hospital beds and into a safe, professionally staffed setting. We've already started this effort with the Beaumont Rehabilitation and Skilled Nursing Center in Worcester. We all understand that this is a disruptive activity for current residents and their families, and in many cases also for staff. And our teams are making every effort they can to make temporary relocations as smooth and as comfortable as possible. And we're especially appreciative to the leadership and the team at Beaumont who have answered the call from the Commonwealth to be the first of these needed designated skilled nursing facilities. Beaumont will help us bring 300 skilled nursing facility beds online in the Worcester area, and they anticipate opening 150 of those beds by Thursday. We need to continue to create significant capacity so our most vulnerable population, should they get infected with COVID-19 and need acute care in a well-equipped and safe setting, will get it. We know this isn't an easy task, but without these designated sites, hospitals would have to discharge COVID-19 patients to any skilled facility with an open capacity, which could put the rest of the healthy residents and the staff at those facilities at risk. This step will help us avoid imposing a mandate on skilled nursing facilities to take COVID-19 patients from hospitals, and will have those facilities that are actually stood up to do this work much better positioned to do it well, to do it right, and to do it safely. The goal is to have about 1,000 beds available for older residents as we plan for the COVID-19 surge. We've also received federal approval from CMS to implement this program, and we'll continue to work this issue around the clock to increase our bed capacity to prepare for the surge. Finally, I'd like to take a minute and update the situation with respect to unemployment benefits. I think most people know that last week Congress passed a substantial federal relief package that includes significant resources for unemployment insurance. There's a lot of good news here, And perhaps among the most important good news is the federal legislation will provide unemployment compensation to individuals who do not currently participate in the unemployment insurance system and therefore are not covered under existing federal unemployment law. This includes individuals who are self-employed, those who do contract work, and those who get paid using what is called a 1099. Those individuals, in addition to that, individuals who have recently exhausted their weeks of unemployment benefits and individuals who do not have sufficient earnings over the last year to qualify for state unemployment would also be eligible for this program. The CARES Act also extends the number of available weeks of benefits for all claimants and supports claimants' weekly benefit amount by $600 for the next 4 months. The not so good news is that states are still waiting on guidance from the federal government on how to implement and start distributing these funds. We expect this guidance to detail application requirements, business rules, eligibility determinations, exceptions, and technical requirements, all of which are critical to assuring that this program gets off to a good start. We continue to have active conversations with our federal partners. In fact, people were on the phone all weekend with them. But these benefits are not available to be applied for today. Right now, it's important that Massachusetts residents seeking these new federal benefits don't apply through the state's current unemployment insurance platform. Until the program is actually implemented under the federal guidance, those resources won't be available and the rules won't be in place to determine eligibility or how much people get on each of their checks. If you attempt to apply for them now, you won't be able to get through the system because the system won't actually have your name in it. And it may create a risk and a traffic jam for others who do qualify, who do participate in the existing unemployment insurance system and are able to access existing unemployment benefits. Everybody could really help us on this one, and the hundreds of people who are currently working to process claims, answer phone calls, and deal with questions and concerns, if people who are eligible under the new rules can wait to apply for the new federal resources once we actually get the information from the feds about how to implement the program, and we can then make that information available to all of you. The Executive Office of Labor and Workforce Development will post an update as soon as we get guidance from Washington on this with respect to the rules of the road. Please know our administration is committed to ensuring that these resources get to the people who need them, and we understand the urgency for everyone during these particularly difficult times. Updates will be posted on mass.gov/unemployment/COVID-19 as soon as they are available. I think some of you know that last Saturday, my wife Lauren and I visited the Red Cross in Dedham to raise awareness of the need for folks to continue to donate blood during this time. There is a crucial need for blood donations, and this need is not going to go down anytime soon. When we issued our emergency order ordering the close of all non-essential businesses, we specified blood and plasma donations as an essential service for all the reasons that would make sense to just about everybody. And even though so many of the things we typically do on a day-to-day basis have ground to a halt, things like giving blood are not only important, but more necessary than ever to ensure the health of our residents and our communities. It was great to see people out on a Saturday serving their community, even in the midst of these very uncertain times. The Commonwealth is chock full of residents who are dedicated to making this a great place to live, and my wife Lauren and I were both reminded of that in a powerful way on Saturday. I want to say thank you to all the residents of Massachusetts for their patience and their perseverance and their determination during this time. We know many of the measures that we've put in place have been disruptive and difficult, but if everybody follows them, we believe they will have a significant impact on slowing the spread of the virus and make it possible for our healthcare system and our communities generally to manage the surge and to come out the other side of it in a position to successfully figure out how we move forward from there. And with that, I'll turn it over to Secretary Sutters.
Good afternoon. Thank you, Governor. Just a couple of updates. You've heard most of them from the Governor. So I want to address a little bit of the Mass Health Connector. So the Massachusetts Healthcare Connector is taking extraordinary measures to stem the flow of coverage terminations for healthcare and medical pharmacy service denials that, while routine in the ordinary course of business, we believe to be inadvisable at this time. I have authorized the connector to delay terminations and service disruptions by delaying batch system jobs that terminate users for a variety of periodic reasons, mostly administrative ones, around the lack of submitted documentation on a timely basis, data matching, and inconsistencies. With regard to premium payment delinquencies in the individual family market that lead to terminations, we would currently estimate that roughly 6,000 members would be dropped from coverage, and another 12,000 to 16,000 would start having medical or pharmacy services denied in April, owing to end-of-the-month processes running now. We believe that at this time, this is the least disruptive option for continuity of connector member health care insurance, and that such coverage is important to the overall welfare of our membership and the health community at this time. As you know, last Friday we launched Buoy. Where I come from, we actually pronounce it Boy, so Buoy, a new online resource tool for Massachusetts residents to check their symptoms and connect with appropriate resources. The tool, as we have been very clear, does not replace emergency medical care, but it can be used as a support for residents during the COVID-19 outbreak to connect them with appropriate healthcare resources if they display coronavirus symptoms. The online 24/7 tool is free for Massachusetts residents and uses current COVID-19 guidance from the CDC. To date, nearly 20,000 people have used the tool. The actual number is 19,645 as of 9 a.m. this morning. Visit buoy.com Mass to learn more and use the tool. And finally, the 211 line continues to be a resource to residents of the Commonwealth and has handled 23,796 calls. And the Mass Alert, the cumulative total to date is 161,000 hits. Thank you, Governor.
Questions?
Governor, last night the President said that the governors are pretty happy how the federal government has been distributing equipment to the states. Are you pretty happy?
Well, what I would say is that I think for governors generally, the whole issue of personal protective equipment has been a difficult one. I've made that clear to the people in the administration as well as to many of the folks who work down the chain from there. I think the quick turnaround we got on our ventilator request, which was processed in maybe 48 hours or so, with the recognition that we do in fact have a demand or a need for somewhere between 1,000 and 1,400 ventilators, and getting an answer on that in less than 2 days, with an assumption that those will be here sometime by between now and the end of the first week in April, was a big positive step forward in the right direction. But we continue to chase PPE through a whole variety of alternative supply chains, and as I've said before, and I know I speak for most governors when I say this, you don't have a confirmed order until it actually shows up. And my view on that one continues to be that I'll feel a lot better about that ability to actually deliver on a confirmed order when one shows up. I do appreciate the fact that the stockpile did send us some additional gear over the weekend.
Governor, how much did you receive over the weekend, and have you guys received an explanation of how the stockpile is saying Massachusetts gets X or this state gets Y?
So the guidance that we get from the feds with respect to how gear gets distributed out of the stockpile is based on a set of calculations and sort of projections that they make with respect to where the most significant issues are at any given time with regard to need. So for example, Washington, certain parts of California, the greater New York metropolitan area has been viewed for, I think, the better part of the past 10 days or so as sort of one of the primary areas of concern. That said, many governors, including me, on the calls we've had with both the president and the vice president and folks on their team, have pointed out that the number of communities and the number of areas and counties and states where the numbers have been moving pretty quickly is growing.
Looking at this information
Well, if we get the 1,000 ventilators that the feds have basically committed to delivering, that will make a big difference for many of the folks in our hospital community. We also have several orders outstanding that should have a delivery date of this week on PPE. And if those orders actually get delivered, that will make a really big difference, not just for our healthcare community, but also for our first responders and our emergency management professionals. I think the experience that the command center had with standing up this COVID-19 specific skilled nursing facility at Beaumont, if that turns out to be a model that we can do in a bunch of different areas around Massachusetts, the real benefit of that is you'll have people running those and operating and working in those facilities who will be particularly trained to serve that population, and it will make it possible for people who don't need to be in a hospital anymore to move to a lower level, thereby making it possible for the hospital to serve additional people who do need to be served at the hospital level. With respect to timeframes, this isn't an exact science, but generally speaking, most of the calculations that are out there with respect to Massachusetts, both some of the ones we've done and some of the ones other people have done, suggest that the surge here is probably going to start somewhere between the 7th and the 17th. Well, we've been doing a lot of things through social distancing and other mechanisms to bend the trend on that surge. But the mere fact that we're asking for and anticipating that we need 1,000 ventilators, and the feds have basically agreed to that, and we're looking to put 1,000 COVID-19 nursing home beds in place, and to do some other work with the Army Corps around creating what I would describe as additional step-down capacity, and the fact that we canceled elective surgeries here in Massachusetts and made possible a whole series of other initiatives around both staffing and the ability of people who have retired to come back to work would imply that we think it's going to be a pretty big deal.
A lot of people were really shocked over the weekend to hear talking to Tony Fauci and President Trump agreeing that we could see 100 to 200,000 deaths nationwide. Do you have enough data here in Massachusetts to give us an estimate of what public health people are thinking might be a range in Massachusetts?
I don't know what the detail underneath the projections that they made look like. Obviously, a huge part of what we're trying to do, both through preparation around the surge and a lot of the other work we're doing, is to make sure that everybody who can be saved is saved. And I prefer to think about it that way than I do with respect to some really sort of cold and impersonal number. I know a couple of people who've lost people as a result of the COVID-19 virus, and it's a way more personal item in my mind than any number you could put on it.
There were reports over the weekend that parks were overcrowded, certain outdoor areas. Do you think people are taking the stay-at-home advisory seriously, and would you consider fining people who don't?
So the first thing I would say is, yes, I do think people are taking this seriously. I can't speak for everyone, but what I can tell you is almost every community in Massachusetts has posted at some point before and after pictures of what their downtowns and their communities and their roadways look like before we put the stay-at-home advisory and the essential business order in place, and what it looks like afterwards. And you just need to look at the traffic on the public transportation system to know how much different things are now than they were once upon a time. I think the issue with respect to the outdoors is a complicated one. On the one hand, to deny people an opportunity to go outside when we've already denied them an opportunity to go to a restaurant or go to work or go to so many other places, I think people need to be able to go outside. And I know that Secretary Sutters would say for the mental health of people, they need to be able to go outside. And certainly having people practice appropriate social distancing when they do is critically important. And I can tell you that in the places and spaces where I saw people outside over the weekend, there were a lot of them, but people were, maybe a clump of 2 or 3, but for the most part, they did a pretty good job of not congregating in big, tight groups. I do think this is going to be an ongoing issue for us, and one we're going to continue to have to discuss with our colleagues in state and local government and with our colleagues in the public health community based on what we see happening in places around the Commonwealth. And I'm not taking any options off the table.
Governor, what do you think of the Rhode Island governor's more strict traffic bans, stopping cars leaving the state, things like that? Smaller state, fewer roads.
As opposed to using the sort of travel advisory that we've used. I think the travel advisory we're using sends a similar message, and I think each state is going to make decisions based on what they see going on in their particular state. And as I just said to the previous question, we're not going to take any options off the table.
Are you considering any enforcement measures on that?
Say again?
Are you considering any enforcement measures on that same subject?
Well, my understanding of what they did in Rhode Island doesn't have enforcement measures attached to it. It's a gathering of information and a follow-up. I don't think there's, quote, an enforcement measure attached to it. I could be wrong. I could be wrong about that.
Some doctors talk about hospitals considering DNR orders for coronavirus-related illnesses, those who are on ventilators. Is that something in Massachusetts hospitals?
I can't hear you. I'm sorry.
Some doctors talked about the possibility of hospitals implementing DNR orders for all coronavirus-related severe illnesses. Is that something you think Massachusetts hospitals should consider, once if we're seeing more and more cases and severe cases?
Okay, so my understanding about DNR orders is those are issued by the patient, not by the organization. And that's how it has been, and that's how I think it should be.
Governor, on the
Bruce, go ahead.
Oh, yeah, I'm sorry, I don't cut you. I noticed you never wear a mask. Seems to be a lot of debate about whether wearing a mask is a good idea or not. Why don't you or your administration thought you should wear a mask?
I think the thing we're doing most of all is practicing social distancing. We almost never have meetings anymore. We have conference calls. And this is about as close as I ever get. I mean, I've been closer to this guy than I've been to anybody outside my wife for the past couple of weeks. I think the thing we can do that's the easiest and simplest to manage is just live up to the requirements and the commitments associated with social distancing, and that's what we do. And if we have PPE available, we're giving it to first responders, emergency management personnel, and healthcare workers, because they are the ones who are spending the most time in close contact with people generally who are symptomatic and dealing with issues around COVID-19. Yeah.
On the patient recovery sites, have you guys identified any other sites besides Beaumont, and are you considering closed facilities like Quincy Hospital or closed nursing homes?
I mean, we started a rundown several weeks ago where we were looking at all kinds of facilities, some of which were closed and some of which were open. The benefit, frankly, of trying to figure out something that works with open facilities is you have staff there and a management team that are already familiar with the operation of the facility and each other. And the feds have also made pretty clear that they're going to create a separate category for reimbursing under facilities who provide services to folks who are dealing with COVID-19, which makes it a much less risky play for provider organizations to head in that direction. So our primary objective was to find places where there were actually, staff in place, management team in place, going concern, contracts in place around food service and everything else, because that's a much easier transition than it would be to try and open up a facility that hasn't been open for a while and then figure out how to staff it and all the rest. And in some cases, some of the ones we looked at, you'd have to do a lot of pretty significant building reworking to make it work in the context of serving as a COVID-19 facility.
Governor, Israel laden health announced pay cuts today. The Mass Medical Society has been asking you for some help, grants, loans, what have you. What can you do?
Well, the thing we've offered to many provider organizations during this period, and we have to be careful about this on our own, is financial support, bridge lending or cash advances, and we've done that already to the tune of several $100 million. And that's a conversation that frankly continues to go on a facility by facility or provider by provider basis with the folks at the command center.
Is there any update on rent and mortgage payments? Or we freeze that?
Well, the first thing I would say is remember, in Massachusetts, you have 90 days to cure on a mortgage payment, and you have 60 days to cure on rent, and the courts aren't open, and you can't evict or foreclose on anybody if the courts aren't open. And they're not going to be open until at least the third week in April. And we are paying a lot of attention to this.
Given all the sports, it sounds like the MIA is deciding to maybe start sports when the school resumes, like going in past the school year. Any comments on that? Is that something that's they give you this advice, right?
I mean, Lieutenant Governor and I are both parents of kids who played a lot of sports, but honestly, that's not something we've spent a lot of time thinking much about.
Thanks, everybody.
Should the surge materialize the way we are concerned it may, is there any one particular place in the system that you're most worried could be the breaking point? Lack of equipment, or is it lack of ventilators, or is it insufficient bed space, or is it lack of personnel, or are they all in the same boat? Is there any one place that you really kind of zero in on as this could be our Achilles heel?
I mean, the way we think about it, honestly, is all four of those things. I mean, we had conversations this morning with a whole bunch of folks from the healthcare community about gear, about bed capacity, about ventilators, and about staff, okay? And we literally have people who are working all four of those issues to make sure that none of them is ultimately the problem for us once the surge happens. And I will say this, you know, there's a ton of research out there now and experience in other places that if you do the sorts of things that we've been doing around social distancing, and if you keep people from spending a lot of time with each other, as painful as that is for everybody, and I get that, you do have an impact on how fast the virus can spread, which is exactly why those types of very disruptive and difficult decisions have been made by so many folks, not just in the US, but around the world. And it does buy you time to put in place the kinds of mechanisms you need to deal with those big four that you just talked about: the gear, the ventilators, the bed capacity, and the staff. And that's exactly what we're doing and working toward. Thank you. We'll have more to say about that a little later this week.
Are you thinking about any restrictions on the short-term rental industry as government, I understand, restructure office about?
We will have more to say about that shortly. The one other thing I would say to all of you, I'm actually shocked no one asked it, which is why it wasn't in my remarks. We are taking a good look at the second set of essential business guidance that we got from the federal government over the weekend, and are also taking a look at extending the existing essential work only order, and we'll have an announcement on that tomorrow.
Thank you.
How's Dr. Morrell?
She's good. She's teleworking from home. And she's a great example of somebody who was a very aggressive social distancer.
Thanks for asking.
And I think, thank you for asking. And I would just add to that, I can't express enough how important it is that people wash their hands, use hand sanitizer, socially distant, do these things. Because in many cases, in many places, over the course of the past 5 or 6 months, they've been proven to work. So do them.
Thank you, guys.